Hi everyone, my name is Elizabeth Cozy. I'm a nursing student from Plattsburgh University. I did my clinical project on improving patient satisfaction through pain management in the post-operative patient. Pain, you can assess it, there's acute, chronic, and in my case, post-operative pain. Pain is assumed for a patient coming right out of surgery. Poor pain management for a patient can lead to psychological, physiological, and socioeconomic problems. In PACU, I observed the nurses using the 0 to 10 numerical scale or the long Baker faces scale for the pediatric patients. But for patients coming right out of surgery, they have a limited ability to verbalize their pain because they could be groggy or lethargic. So I researched a new tool that allows the nurse to assess the behaviors of the patient rather than asking them to verbalize their pain. So for my project, the quality improvement objectives: determine whether the patient's pain is treated in a timely or an effective manner. Determine whether patients are discharged from the PACU with a significant amount of pain. And identify the surgical procedures at high risk for producing significant amount of postoperative pain. So the quality improvement and staff development was performed on the nurses in PACU. In-services and staff meetings were held to educate the nurses in order to provide safe patient-centered care, perform efficient pain assessments on the postoperative patient, and improve pain awareness of nurses' attitudes towards patients' pain. So like I said, I researched the new tool for the pain assessment. It's called the Post-Anesthesia Care Unit Behavioral Pain Rating Scale, or PACU BPRS. It's used by the nurse observing the patient's behaviors without disturbing their comfort. It focuses on rating pain behaviors of a patient, whether they're restless, they could have muscular tension, their facial expressions like grimacing or frowning, and any other audible sounds from the patient. So as you see here, I put an example. It's rated from the 0 to 3. 0, the patient is calm, relaxed, there's no frowning or grimacing, and they speak normally, or they're silent or sleeping. And then the most pain, they're very restless, they're extremely tense, they're constantly frowning or grimacing, and they're crying or sobbing. So expected findings for the project: the nurses of the PACU are going to complete a competency on the pain awareness and the pain management with the new tool, the PACU BPRS. All nurses are expected to pass the competency with an 80% or more, and a questionnaire given out to the patients in PACU before discharge. They're expected to show 50% of improvement on their discharge before PACU discharge. So the most important thing to take from this project is to include the patient and communicate with them. Patients may be unaware that they need to express their need for pain relief, so we have to educate them. Sometimes they don't want to seem like they're complaining, or they say they don't want to take the nurse away from other patients because they don't think pain's really a big deal or an issue. So we have to educate them that pain is a problem and we have to control it. And if patients are told that their pain behaviors are being observed and rated, it may help them freely express their needs. So with the proper educational programs and implemented pain assessment tools for nurses to use, nurses can improve their knowledge of pain and improve patient satisfaction by providing higher quality of care. Thank you.
Thank you. Thank you.